Let's talk about knee pain today, specifically knee osteoarthritis. That is the fourth leading cause of disability. Knees can hurt, and your chance of having knee osteoarthritis definitely increases over the age of 40. By the time you're over the age of 60, it's about 10 to 15% of the population. It's definitely worse in people who are overweight, and age is a risk factor. It's become more problematic and expected to be more of a problem going forward. So let's talk about what you can do about it. We do have a lot of medications, and I prescribe a lot of medications. I do think exercise is probably the best mainstay of treatment. If you can strengthen the muscles around your knees, kind of harness and keep your knee in place, that's often helpful in reducing the pain from knee osteoarthritis. So exercise is usually the go-to. But if that doesn't work, there are medications. Now, some people can take them, some people can't. There are potential side effects, and people want to know about food. What can you do in your diet and perhaps have some natural treatments that could help with knee pain, specifically from knee osteoarthritis? So let's talk about those. A little less than 50% of people use complementary treatments to see if the antioxidant and anti-inflammatory effects of them will help reduce the pain in their knees. So we should know if there's any evidence behind these. So let's talk about foods that can help reduce knee pain. Let's start with ginger. So ginger is interesting. It's been used forever for cooking, for foods. Pain now also is something that people are using it for. For example, a study published in the Journal of Medicine found that ginger extract reduced pain and stiffness in people who had osteoarthritis. The effects were comparable to those of NSAIDs or non-steroidal anti-inflammatory medications. There was a 2001 study on ginger in about 260 patients who had osteoarthritis of the knee and they had moderate to severe pain in their knees. And they received ginger extract or placebo twice a day, and they were followed to see how their pain changed. They were allowed to use acetaminophen as a rescue drug. The results were superior in the ginger extract group compared to the placebo group, and it was about 63% to 50%. So not a huge amount, but still there was a difference in this group that had the ginger extract. And what did they see? So there was a reduction of pain when they were standing. There was a reduction in knee pain when they walked about 50 feet, and there was less use of the rescue medication, which was acetaminophen. So overall, it was a success. There are a lot of little studies like this, not huge ones, that are showing that ginger can be effective. Let's move on to strawberries. So strawberries, there's all this talk about berries being helpful for osteoarthritis. And there's been some studies now with strawberries specifically to see if it could help knee osteoarthritis. What did they find? There was a tiny trial. It was about 17 patients over the span of several months, and they wanted to see if taking strawberries would reduce the amount of pain in their knee osteoarthritis. So who was this group? A group of people that had knee osteoarthritis shown on their x-rays. They had mild to moderate knee pain. So this group had it on their x-rays and they had pain, and they were given this powder. It was an interesting strawberry powder, and then the control group was also given a similar looking powder, so it wasn't easy to tell which one they had. And they followed this group of people and wanted to see if nutritionally supplementing them with strawberries helped their knee pain. So what did they find? There was a reduction in the amount of pain in the group that had the strawberry powder in comparison to the other group. Specifically, they saw certain biomarkers of inflammation come down, including IL-6 and MMP, metallomatrix proteinases. So what's nice about this trial is that it was finally a trial. They've been suspecting that maybe berries can be helpful in knee osteoarthritis. So there was a trial done with two groups of people, the placebo and the control group. The issue is that it was small and it was done on a obese population. So we don't really know how strawberries would affect you if you were not overweight or if your injury was from sports related or something else. This was very specific to the knee osteoarthritis population, but still good to know some evidence is there. And we know that strawberries can help other things, considering they have great antioxidant properties as berries. And so if it's helping the rest of your body and your heart, it's probably not a downside to it. A side note about tart cherries, which people are very excited about. The studies and evidence for knee osteoarthritis were not great, to be honest. There was more for strawberries than there were for tart cherries, although I would say overall evidence remains low, but something to think about. There's been a lot of studies about turmeric, and specifically the active compound within it called curcumin. This has helped reduce inflammatory activity in arthritis pain. There was a really interesting study in which they measured against diclofenac, which is a standard of care medication. I prescribe it, and they compared this curcumin group and the diclofenac group, and they saw that there was definitely increase in pain in both groups. But what was interesting is the group with the curcumin had less issues with flatulence, which I don't know of anybody that wants to experience more gas when they take a medication, but it was an interesting effect that they were studying, and that's what they saw in it. So the curcumin group did pretty well with the NSAID group, but less gas. The study was interesting. They took 500 milligrams of curcumin and gave it to one group 3 times a day, so 1,500 milligrams in a day, and the other group got diclofenac twice a day. So this was pretty comparative to standard of care medication. And the results of this showed, day 7, the patients who received the curcumin experienced significantly greater reduction in the number of episodes of flatulence. And the benefit of curcumin was observed because of anti-ulcer and gastroprotective effects of curcumin. Dosage. So I know people are always asking how much to take. There didn't seem to be a great amount of difference in people who were taking over 1,000 milligrams versus those who were taking 1,000 milligrams or less. Keep that in the back of your mind. You may not need to take super high doses to get relief for knee pain. So this could be an alternate to NSAIDs in the group that cannot tolerate them. And there's quite a lot of people out there that cannot tolerate anti-inflammatories like NSAIDs, which are also known as painkillers. The caveat with this was that the curcumin that they used was called BCM95, and they considered it a more bioavailable curcumin. So it may make a difference onto what kind of curcumin supplement you take. There's been a lot out there about the Mediterranean diet, and specifically the main fat that's used in it is olive oil. For its considerable antioxidant and anti-inflammatory properties, it's been thought that it might help knee osteoarthritis related pain. There's been a few studies with olive oil as applications, like rubbing them on the joints. And one of the studies showed that there was a reduction in pain. They had a reduction in pain in both the olive oil group as well as the control group, but it seemed to be more of a reduction in pain in the olive oil group. So it was helpful for these people. And then another study showed that it was olive oil, application of olive oil with the application of diclofenac gel, which is kind of a standard of care, right? We tend to use ibuprofen type of gels like a diclofenac gel to help relieve pain for knee osteoarthritis. So it was interesting to see this study compared with olive oil as an application. What did they find? This study, which was from Iran, used high quality olive oil, which was called Familia, and they used it against the control group. And they found that in the experimental group, amount of pain decreased from 8 to 1.78. And in the control group, it went from 8 to 3.85. So from 8 to 3 basically, versus 8 to 1. So in both groups, they got better. And this is what happens when you have placebos, because a lot of times they do work. Pain was a little bit better in the olive oil group. Now, I don't know. Diclofenac gel can work pretty well. Diclofenac orally by mouth can also work very well. So is olive oil application really better than that? All I know is that a lot of people cannot take these medications and they're looking for alternatives. And as a side note, since I'm a rheumatologist and I treat rheumatoid arthritis, there was a study with olive oil application in a rheumatoid arthritis group of female patients who also did better with this olive oil application. So overall, there is no great medication for knee osteoarthritis. We have some that can be used, and all of them come with their own potential side effects. Food and looking at the diet might be another way to help improve the pain from knee osteoarthritis if other modalities like exercise and medications are not entirely helpful.